Often there is a misconception that staffing is a number, a magic number. If in a facility there's 12 residents on the hall, there should be 2 staff member. On a long-term care hall, perhaps there's 30 residents on a hall. So then people believe, well, we should at least have 4 or 5 staff member because it would be too difficult to meet the care of those residents. So having a magic number certainly feels good. However, the magic number is non-existent because it really depends on the needs of every resident. If you have 30 residents on one hall, but many of them, 20, 25 even, are pretty independent, maybe can be independent with dressing, be independent getting to the dining room, be independent with getting to the bathroom. They just maybe need some help with their medication and grooming and eating, for instance. Then they're not going to need as many CNAs on the hall as if you had 15 residents, for instance, that were what's called full assist. They needed 2 people assist. They needed maybe a mechanical lift. They needed 2 people to help them get to the bathroom or help them change their brief because they're incontinent, or residents who can't do any of those things. They can't provide any help at all. So they need 2 staff. So 15 residents and 2 staff, that's hard. That's hard work for those 2 staff. Ideally, maybe have another staff member that maybe floats between 2 halls, or maybe a bath aide. Some nursing homes use a bath aide just to do baths. And then the other 2 are providing the care for dressing, for toileting, for getting folks to meals, for helping them eat, all those different things. But there's no magic number. It's really based on what the resident needs are. When I go to a facility to talk with the nurse who's on that hall, I will go to the nurse and I'll say, number 1, how many residents are you responsible for? And she will say, well, on this shift, I have 20 residents that I'm responsible for. Great. Okay, good to know. That's a starting point. Second question is, how many of those residents require 2-person assistance, whether it's 2 people standing there while they transfer or 2 people using any type of mechanical lift? Then they give me the number. And if they say, I've got only 5 people that require 2-person assistance, then my next question is, well, tell me the names of your CNAs. And they'll tell me, I've got Betty and Susie and Mary. Okay, great. And do you share those CNAs? Well, I share Mary. I share Mary with my hall and the hall next door to me because Mary does a lot of showers. Okay, great. So you have these 2 CNAs that are exclusively on your hall with only 5 people that need assistance, and then 1 other CNA that goes back and forth. And then I will go throughout the building and talk to each nurse who's responsible for a hall to assess that. Because I'll look at the whole number and say, okay, you've got X number of residents, but only a smaller number require 2-person assistance. Therefore, either the staffing needs are met or the staffing needs are not met. So that's the first level of staffing. The second level is talking to the residents and observing, are there unanswered call lights? Are there residents in the dining room who aren't getting assisted because there's not enough staff to assist them? Have there been accidents such as falls, things like that, because there's not enough staff to provide supervision? So staffing plays, when you look at staffing and review staffing for a facility, you're really looking at all those different components. And many people think, well, it just goes back to there's 100 people and there's only X number of staff. There's no way they could meet the needs. And there's a lot of variables that are looked at when you're assessing staffing in a nursing home.